Sickle cell anemia is the most common form of sickle cell disease. Sickle cell disease is a serious disorder in which the body makes sickle-shaped or crescent-shaped red blood cells. Normal red blood cells look like donuts but without the holes in the middle. Red blood cells contain an iron-rich protein called hemoglobin, which carries oxygen from the lungs to the rest of the body. Sickle cells have abnormal hemoglobin that is referred to as hemoglobin S. Sickle cells block blood flow in the vessels of limbs and organs, which in turn can cause pain and organ damage. Sickle cell anemia is an evolutionary trait against malaria, which is why sickle cell is found mostly in African Americans. In fact, about 1 in 12 African Americans have this disease. While I do not know anyone personally with this disease, I have done an extensive amount of research and have performed a handful of speeches over this topic. In order to fully understand the sickle cell disease, I will explain and go more in depth on the signs and symptoms, complications, and treatments and drugs for this disease. Let's begin by discussing the signs and symptoms of sickle cell anemia. While some people may have mild symptoms, others may have severe symptoms and often have to be hospitalized for treatment. Sickle cell disease is not something that you grow into or develop as an adult. It is present at birth, however, symptoms may not present until around 4 months of age. The most common signs and symptoms are linked to anemia and pain. Other signs and symptoms are linked to the disease's complications. According to the National Heart, Lung, and Blood Institute, the most common symptom of anemia is fatigue. Other signs and symptoms include shortness of breath, dizziness, headaches, coldness of hands and feet, and jaundice. Sudden pain throughout the body is a common symptom of sickle cell anemia. This is called sickle cell crisis. Sickle cell crisis will often affect the bones, lungs, abdomen, and joints. While chronic pain can happen with sickle cell crisis, acute pain is more common. Acute pain is sudden and can often last up to a week or more. Chronic pain normally arouses in the bones and can last up to a few months and can be mentally draining. Almost everybody with sickle cell anemia will have painful crisis at some point in their lives, whether it happens once a year or once a month. If you are dehydrated, the risk of sickle cell crisis will increase. Drinking plenty of fluids can lower the risk of a painful crisis. Painful crises are a leading cause of emergency room visits and hospital stays with sickle cell patients. Now that you are aware of some of the signs and symptoms of sickle cell anemia, let's look at some of the complications of the disease. Sickle cell crisis can affect many parts of the body and in return can cause many complications. One of the complications is called hand-foot syndrome. This occurs when sickle cells block small blood vessels in the hands and feet. This is most common in children under the age of 4. When hand-foot syndrome is present, swelling will occur in the back of the hands and feet and will move into the fingers and toes. Another complication is called splenic crisis. The spleen will sometimes trap red blood cells that stream into the bloodstream. When this happens, it causes the spleen to enlarge, which leads to anemia. If the spleen traps too many red blood cells, you may need blood transfusions until your body can make more cells and recover. Children and adults who suffer from sickle cell anemia may get infections easily and have a hard time fighting them. This is due to the anemia damage that is caused to the spleen, an organ which helps fight infections. Infants and young children who have damaged spleens are likely to get a serious infection and it could kill them within hours or within days. Bloodstream infections are the most common cause of death in young children who have this disease. Medicines and vaccines can help prevent some infections such as meningitis, influenza, and hepatitis. It is very important to get treatment right away if you get a high fever, a cough, have problems breathing, bone pain, or headaches. Acute chest syndrome is a life-threatening condition to someone with sickle cell. It is very similar to pneumonia. People who have this will often have chest pain, shortness of breath, and fever. Pulmonary hypertension occurs when there is damage to the small blood vessels in the lungs, making it hard to pump blood. This will cause blood pressure to rise in the lungs. Children who have sickle cell will often grow slower than children who do not. A shortage of red blood cells will cause slow growth rate, causing puberty to reach later in their life. 2 forms of strokes can occur in people with sickle cell. One form, if a blood vessel in the brain is damaged or blocked. This occurs more often in children. The other type of stroke happens if a blood vessel in the brain bursts. Eye problems are another complication of sickle cell disease. It can cause damage to the retina, which can cause blindness. The last complication is rare but is very serious. Multiple organ failure happens if you have a sickle cell crisis that causes 2 out of 3 major organs to fail. Complications of sickle cell can be serious, but they can be maintained with treatment and drugs. According to the professionals at the Mayo Clinic, medications used to treat sickle cell are antibiotics, pain-relieving medication, and hydroxyurea. Children with sickle cell anemia may begin taking the antibiotic penicillin when they are about 2 months old until they're about 5. This will help to prevent infections such as pneumonia, which can be life-threatening to an infant or young child. Antibiotics may also help adults with sickle cell anemia fight certain infections. Your doctor may advise you to get some over-the-counter pain relievers and application to heat to the affected area if you're experiencing some pain. You may also need stronger prescription pain medication if the over-the-counter medication does not help you. When taken daily, hydroxyurea reduces frequency of painful crisis and may also reduce the need for blood transfusions. Blood transfusions will increase the number of red blood cells in the body, helping to relieve the anemia. Blood transfusions can also help decrease the risk of strokes in children. Sickle cell anemia is the most common genetic disorder in the United States and is most common in people whose families come from Africa, South or Central America, Caribbean islands, Mediterranean countries, India, and Saudi Arabia. It is estimated that sickle cell anemia affects around 70 to 100,000 people in the United States. Sickle cell occurs in more than 1 out of every 3,600 Hispanic American births and 1 out of every 500 African American births. Statistics show that this condition occurs in about 1 in 12 African Americans. I hope that you now have the knowledge and education of the signs and symptoms, complications, and treatments, so if you or someone you know shows signs of sickle cell disease, you can point it out and seek treatment. I will leave you with this fact. More than 2 million Americans carry this sickle cell trait.